Hello everyone, I'm Dr. Arthur Polela from Levi Mwanawasa Hospital in Lusaka, also an ambassador for the African Society of Regional Anesthesia. Today we're going to be looking at the Erector Spinae block. And this is a perfect block for mastectomy, thoracotomies, as well as some rib fractures, for example. So for that you need, usually you get away with a linear curve. That would depend on the habitus of the patient. With a linear probe, that will work for most lean patients. For more heavier patients, you may need a curvilinear probe. The depth will depend on whether or not we can see the ribs as we see when we scan. So assuming that I'm doing this procedure for a breast surgery, I want to palpate the scapula, also assuming that all sterility has been observed and you've got the appropriate needle. You want to palpate for the lower border of the scapula and go medially. And that is approximately where you want to deposit most of your local anesthetic. So to scan, you start laterally looking for the ribs. The ribs appear as rounded structures as you see on the screen. They appear more rounded compared to the transverse processes, which look more straight, more flat at the upper surface. We'll see that as we scan medially. So from the lateral aspects, you scan towards the midline and wait for your rounded appearance of the ribs to become more flat. And right about there, if you see on your screen, you see that the image that we have there is a structure that's more flat at the top. And your erector spine will vary in length, depending on, in thickness rather, depending on the musculature of your patient. So that looks like a good image to me. Bear in mind that as you go beyond, you see a white line, white structure there. That's the pleura, and it should be avoided to avoid the pneumothorax. You want to deposit your local anesthetic just below the erector spinae muscle, which is a muscle right at the top of the transverse processes. And your local anesthetic should spread, you see it as an expansion of the fluid in that plane. So you've got two options with your needle approach. You can either approach it from the caudal aspects towards more cephalad, or cephalad towards the caudal aspects. I prefer from the caudal towards the cephalad aspects. Okay, let's optimize our image again. Okay. So your needle will be coming in from the caudal aspects and about ½ centimeter away from the probe. Introduce it in that manner, and you should see the needle coming from the right side of the screen in this case, and you are trying to aim for the upper part. Some people will aim for the bony transverse process, but others will say it's more efficacious. You get more efficacy by depositing it in the soft tissue. So I like to deposit my local somewhere around there, and you see it spread and separate the erector spinae muscle away from the transverse process. This is a volume block, so you're going to need at least 30 mL of your local anesthetic. Again, avoid your needle going towards the pleura there so that you do not cause your pneumothorax. Thank you very much.